So, good afternoon, everyone. First, I would, I would like to thank Professor Manuela Dominguez Martins and the entire INCT team for this opportunity. It's a huge pleasure to be here, but it's a challenge. Today, we'll talk about costas and oncology with a particular focus on mucositis. I don't know what's happened here. I don't know if it's Zoom.
Now it's
Again. Okay. So first, I would like to begin this lecture with a short reflection. Dr. Paulo Hoff, an internationally recognized oncologist, on set, a life is a priceless, but has a cost. I believe this statement connects very well with our topic today, the costs of our cancer. When we think about costs in oncology, we can see that it is a growing field of research. A PubMed research, a PubMed search, show a clean increase in the number of studies evaluating the cost of cancer care over time. If you compare the literature from 99 with what we have in 2026, we can see the number of studies in our is increasing. We can see here in this slide. Today, our focus will be oral mucositis. However, case studies are become more common across oncology. As we can see here, we now have studies on cervical, rectal, and lung cancer, and several other types. Here we can see a lot of studies with focus on costs in oncology. In head and neck cancer, we usually think about the major treatment costs, including surgery, radiotherapy, chemotherapy, immunotherapy, target therapies. However, treatment-related toxicities can also have a substantial economic impact. So, when we look at the total cost of the cancer care, we also need to consider the cost of management these complications. In this context, we performed a systematic literature review to try to better understand the direct costs associated with the management of mucositis. We published this article in Oral Oncology in 2021. Oral mucositis is a common and clinically important toxicity of cancer treatment. Oral mucositis can occur during chemotherapy, head and neck radiotherapy, and hematopoietic stem cell transplantation. It may cause pain, and difficult eating, swallowing, and speaking. In severe cases, it may lead to opioid use, nutritional support, hospitalization, and interruption of cancer treatment. As a result, oral mucositis can negatively affect quality of life and may also compromise treatment outcomes. These images help us understand the clinical impact of oral mucositis. Here, we can see the same patient before treatment, during chemoradiotherapy, and on the final day of the radiotherapy. We can clearly see how much this toxicity can affect patients, not only clinically, but also emotionally and financially. This is an important point to keep in mind when we discuss the true burden of cancer treatment. With this clinical burden in mind, our systematic review aimed to evaluate the direct costs associated with mucositis management across the different cancer treatments. We review, uh, the review followed the Prisma statement, and we included 37 studies. These studies evaluate patients receiving radiotherapy, chemo, radiotherapy, chemotherapy, hematopoietic stem cell transplantation, and target therapies. Sorry. Because the article was published, as I said before, in 2021, we covered all costs to 2021 US dollars. For this conversion, you use the Campbell and Cochrane Economics Methods Group of Evidence Practice Information Center, CCEMG-EPPI Cost Converter. This tool adjusts costs and inflation and purchasing power parity with uh, allow us from different countries, different years to be compared. It was very useful tool for our study. Here we can see the website we use for this conversion. Although this website is still listed by Cochrane Economics, it appears not have been updated since 2024. I searched for a newer version or an update web address, but I did not find any official information indicate that the tool had been replaced. In 2021 was very important for our students use this tool because we converted all the values for them and compare for the recent years. Now, moving to the main finds of our systematic review, we observe a very wide range of costs. Across different cancer treatments, oral mucositis was associated with a financial impact range from about $4 to almost $300,000 per patient. As shown in this table, the cost range varies according to the clinical set, treatment type, severity of mucositis, and use of healthcare resources. These costs were mainly associated with greater use of healthcare resources, including emergency visits, support care, and hospitalization. Severe oral mucositis and longer hospital stays were consistently associated with higher costs. The highest cost burden was observed among patients undergoing hematopoietic stem cell transplantation. In this context, was a very important results in my point of view. Photobiomodulation may help reduce the incidence and severity or mucositis, and consequently, the economic impact during cancer treatment. So far, we have focused in healthcare system costs. Now, let's move to the patient perspective. This brings us to the concept of financial toxicity. Financial toxicity is the economic burden of cancer and its treatment. It includes both direct and indirect costs and may affect quality of life, treatment adherence, work participation, and clinical outcomes. We have been exploring this topic, and this week we publish a narrative review on financial toxicity during active treatment for head and neck cancer. In this paper, we discuss how to assess financial toxicity, the main risk factors, and the impact on patients undergoing active treatment. Was very interesting because the most of the studies are evaluating financial toxicity in survivors. So we're trying to understand the real financial toxicity during active treatment. Currently, we are conducting a cohort study through a collaboration between ISASP, the University of Pennsylvania, and INCT Biophoto Connect. We are evaluating financial toxicity during active cancer treatment, including out, out-of-pocket costs, quality of life, and work productivity. We are also using these different validated instruments, as you can see here, to assess or to try to access these outcomes. To record patients' expenses, we developed an application specifically for this study. The app works as a financial diary through cancer treatment. Uh, this slide provides an overview of the out-of-pocket app interface. Patients can record expenses in different categories and review their costs by day, by week, or by month. This gives us a clear view of financial burden during or undergoing radiotherapy oncologic treatment. Here we have a first video showing how this app works. The video shows how user can enter expenses into the different cost categories and review the information recorded over time. The app is now available on the App Store and Google Play. At this stage, we are evaluating in this stage, we are evaluating the app with experts. We try to validate this app with experts and patients in Brazil and the United States. So I really hope to share the results of this study soon. Here we can see how we can manage this app in this interface, in this video. If someone has it interesting, I can share the link in the Apple Store or Google Play Store. But it's very interesting. In my opinion, it's very intuitive. The patients can use every day to add the costs during the treatment. And you tested at ISASP, and the patient was the answers of the patient was very positive. So just wait the video finish. and you can see. So we have this possibility to check development of values during the treatment. And maybe the next step will be include the costs associated with the careers as well. So finally, I would like to thank you all the collaborators and the institutions involved in this project, especially Professor Manuela Domingues Martins, INCT Biophoto Thais Bianca Brandão, and all the SESP team, including Aljomar, Maria Cecília, Karina Moraes. They are helping me a lot in this validation phase in Brazil. Professor Thomas Solicito at UPenn, Luciana Esteban Simonato from Universidade do Brazil, who helped me to develop this app, Manuela Carreira, Alan Roger, and all the team at uh, Unicamp, and also Alice Ribeiro e Silva, my daughter, who helped me with this video. So it was very important. Uh, so thank you very much. Once again, I'd like to thank Professor Manuela Dominguez Martins and the INCT Biophotobucal team for this invitation. As I said, was a challenge for me, but I will be happy to answer any questions. And thank you again.
Thank you so much, Carol. Thank you so much. And especially because your presentation will take place at the end of the year. And then we had to move because other colleague couldn't attend this meeting. And then you jump in, or we asked you to jump in this meeting, and you made a great job. Thank you so much. And congrats for the presentation, for the English was so good. You should do
Oh,
this
thank
more and more. And here I think that we are very safe to do this because we are friends.
you.
Everybody here wants to grow together, and we are not English native speakers. So it's a challenge for all of us. And you did a great job.
Thank you, Manu. Thank you. Very
Questions.
kind. So was a perfect time because the article was just published in this week. Was the perfect time for this lecture.
It was perfect. Carol, are you planning to expand the use of this app? Are you planning to train the people around the globe because you have in different languages and it's very intuitive, it's easy to work with the app. So could you tell us a little bit about the future of the use of this app, what you are thinking as a researcher that developed this app?
Yes, thank you for asking. So I believe the first moment we use in Brazil and the US, and after that, I try to expand to Latin America because we produce this app, we develop this app in three different languages: Portuguese, English, and Spanish. So, but to reduce the time to this moment in US, we are concentrating in try to validate with Brazilian and American patients. And I have we have plans to use in the first moment with head and neck cancer patients, but I believe we can use this app with different kinds of cancers, breast cancer, lung cancer, and we can add different toxicities, financial toxicities in this app to increase the different kinds of cancer, different kinds of patients undergoing treatments.
And Carol, do you think that could be interesting to try to focus in training people to use the app in the public health system in Brazil?
Maybe, maybe. But uh, the main purpose was is different because this app was focused in the patient. So maybe after results, we can uh, have different thoughts about how we can uh, change uh, the possibilities to change the possibilities of this app. Uh, Maybe in the primary care, uh, you can use this kind of app, but uh, it's not simple to develop this kind of app. It was a very hard work. Luciana is here with me. We shared uh, a long, we had tried to develop this app for a long time, and we have the difference between the cultures. It's another point because here in US they are more restrictive about information, about personal information, and it's strange because I can find your house if I put your address in at Google, but they are very concerned about birth of date, about emails, about phone number. So, and we try to understand better because in Brazil, I believe we can use this app, uh,
I think so. In a
but
broad
in other parts of in other parts of the world, maybe you have some difficulties if you compare the systems and the culture in special.
because independently of the knowledge or the social economic development of the patient, everybody nowadays use cell phones, and it's very
Yeah,
easy to work with the product, the
it's
app.
natural.
Yeah, it's very intuitive. So something depending on the information, we had some concerns to approach the patients from private and from public service. But in general, I think that the information that you are catching up with the app are they are easier to be obtained. So
So
let's
even
let's
these days, for example, at CESP, it's a public health system, it's a public hospital, and all the appointments are managed using app from the hospital. So it's a reality. It's not it's not so different. It's not so far to think about use apps during the treatment.
and I think that this kind of investigation could bring us very good results, very good information to deal with these patients, to deal with the cost, to deal with several aspects regarding these patients. So it's very good. Congratulations. I think that I can imagine how hard was for you and the whole team that developed the app. But
Include
I
you.
no, you develop. You are the leader.
Oh,
You, Lou, you had the were more
you are in
involved.
my back
Yeah,
always.
but I think that we have a lot of things to explore, and this could be very beneficial for the service, for the professional, and for the patient. So it's a win-win in all sides. And it's cheap now because it's for free. So for us in other
Mhm.
service, it's amazing that somebody pay for this work, FAPESP and others, because now you are given to us the opportunity to understand a little bit more about our patients, the treatment that we are offering to our patient, how this treatment is impacting. So it's amazing. I'm sure that you're gonna have in the future so many good results with the different populations. So many aspects will come and join this app that will be amazing. Comparing with the different countries, different cultures, it's amazing. It's amazing. Congrats, Carol, and I wish you all the best with this app. And I think that we should spread this message and try to invite the people to start using. Are you planning
Yes,
to give a lecture or a training course, for example, to use this?
maybe in the future, maybe in the future. I believe you need uh, to stress this app in the safe place where I can manage, when I can control the variables, and after that we can share with our colleagues and try to do some uh, collaborative studies and the multi-center studies. I think will be the future, but now I'm trying to use in the safe place.
And I think that one of the concerns is regarding the maintenance of the information in a safe place. So, how are you working with this, with the result or the information? For example, I downloaded the app. If I uh, use the app, you're gonna have all my informations. How are you dealing with this? Only you have access to the information. How many people involved have access to the whole informations? How are you working with this?
We have very strict rules about that in Brazil because if you add this kind of app in the Apple Store and the Google Play, they 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 will check it all this kind of security status of the app. And this was the first step to add this app in these stores. So uh, the another point will be about uh, birth of date and the name of the patient, because we try to manage with the at the least two main two main identification points in this moment. But this in the app you will not add sensitive information, only about price. And it's a different point in my mind now. I can see this way because it's not a sensitive information that you add in the app, except your name and your birth date. But we use commonly this kind of information in another types of app. It's very common. You need to put something to identify yourself using this technologies.
Any other questions?
Yes, I have one.
Oh, good.
Oh, Carol, thank you so much for your talk. I appreciate a lot. I know a little bit about your work, but please, could you tell us about the importance of SUS patients for your work? Do you think it was a challenge to apply this kind of tool in patients from SUS, or it's not a problem? What do you think about it?
Thank you, Professor Eliette. Thank you first for being here with me, and thank you for all the support during my career. You were very important for me. So, uh, I'm trying to think English now to answer this question. But I believe this kind of app is very important at SUS because if you think about about its ASP, we provide all kind all all types of the treatment, oncology treatment for free for the patients. But uh, we didn't realize how many money the patients you by yourself you use during the treatment. Because at SASP, you provide the medicines, you provide the photobiomodulation, you provide the multi professional appointments, but sometimes we can't understand the magnitude, how I can pay to stay, to start my treatment, because I need a career with me and I don't have money to pay for this person stay with me, go with me until the treatment. So uh, about if I have a kid, I need to pay someone to stay with my kid during my treatment, or my grand grandchild, for example, because uh, it's impossible to choose or any kind of health system to provide these direct and indirect costs for all the patients. So I believe this app will help us to understand uh, which kind of person needs uh, when, or which kind of person I need to see to identify. Uh, uh, let me let me change. I need to identify uh, the main person who I can help. Uh, so because I can provide the treatment, but the other parts they are they are fundamental to adherence, for example.
Yes, it's always a challenge. A lot of things together and complicate the life of our patients. Thank you, Carol.
Thank you.
Carol, you are ready to rock in the stage in person in the next event of AAOM. I want to see you over there representing the girls from Brazil, our power. So congrats, was amazing, was really nice. You rock it.
Thank you, Manu. Thank you for your support. Thank you for supporting for kind words. So I'm very nervous to talk English. It's not natural for me, but I'm here for you.
Carol, it was so good. We should do this, and this is the environment. We have to do this together, girls. So, all of you, if you want, I think that this is a safe place to us. And this kind of challenge, it's amazing because if we don't do this, we always stay thinking, I cannot do this. It's hard. I don't know. I'm not fluid. And if we do, it's amazing. Of course, we prepare ourselves. We have to organize
Yeah,
our ideas, train a little bit, but we can do this. We can do this. So, congrats was amazing. Thank you so much for supporting us and being here um, uh, in advance. Yes, yes, girls, Latin American. I love that Eliette, she is the powerful one, representing and taking care of us in all the places. Yes.
thank
Good
you.
girls, good
Thank you
girls.
again for this opportunity.
It was amazing. It was so good. And congrats for all your hard work. You work very hard. You are so good. And for us, it's a pleasure to have you on board of our INCT, leading so many great projects. Thank you for helping us in so many ways. Thank you.
It's the opposite. It's my pleasure. Thank you.
So, kisses, see you in the next one in 15 days. I think
In the
that we're going to be at Sobep. No, no, no. Yes, yes, it will be during Sobep. So, okay, during Sobep, we have a meeting.
See you
Together.
soon. I'll be there.
Yes, we can do together.
See you.
Bye. Have
Nice
fun.
to see you all. Bye bye. Have a nice weekend.